This is my audience. Here are my note cards. Hi, my name is Lisa Bauer. Did you know that most MRSA infections occur in people who have been in hospitals or healthcare facilities, such as nursing homes or dialysis centers? This disease is the bacterium responsible for several difficult-to-treat infections in humans. Last year, 96,360 people in the U.S. were diagnosed with MRSA. MRSA stands for methicillin-resistant Staphylococcus aureus. It is a strain of Staphylococcus aureus that is resistant to antibiotics such as penicillin, called methicillin. It is a bacteria that causes skin infections all over the body. MRSA can sometimes be life-threatening. Because it is so hard to treat, it is sometimes called the superbug. In Great Britain, 10,000 per year, according to British politician George Galloway, die. The MRSA strains were first recognized in 1960, 1 year after the antibiotic methicillin was introduced. The first documented MRSA outbreak occurred in Boston Hospital in 1968. After the next 2 decades, most MRSA infections occurred in people who had contact with hospitals or been in hospitals, MSA, or staff that can be treated with penicillin drugs, and MRSA, which cannot be cured with traditional penicillin drugs and must be treated with alternative medications. In the 1990s, MRSA infections were recognized in people who were not hospitalized or in contact with people in nursing homes. Since then, the cases who live in the community have greatly increased. In 2006, more than half of the infections occurred in healthy people. There are 2 types of MRSA. CA-MRSA, which is commonly known as community-acquired MRSA, is found in healthy people who have not been hospitalized in the last year. HA-MRSA, or commonly known as hospital-acquired MRSA, is more severe and potentially life-threatening. Statistically, 1 in 25 people who have had a surgical site in inpatient surgery get MRSA, which is annually 157,000 people per year, according to the Center for Disease Control and Prevention. Some risk factors of MRSA. It spreads very easily. By having a catheter or any urinary device, it is a pathway for MRSA to get in your bloodstream. Elders are more likely to contract MRSA because of their weaker immune systems. Also, you can get MRSA from skin-to-skin contact through abrasions or open wounds during physical activity. You are most likely to contract MRSA if you are living in a military camp, prison, or daycare facility. Medical researchers also say that if you are homosexual, you will have a greater chance of getting MRSA, especially in males. The ways you can prevent MRSA. You can have good hygiene and wash your hands all the time. Keep cuts, scrapes, and wounds clean. Avoid sharing towels, razors, or any personal items. One test they use to diagnose MRSA is by taking a swab up your nose and growing that bacteria on a culture plate over a couple days. Some of the treatments for MRSA is draining the abscess and then taking the antibiotics such as linezolid and vancomycin. MRSA was founded in the 1950s. As a result of this, it became a popular discussion throughout the healthcare. It has also become more commonly diagnosed in hospitals, nursing homes, and assisted living areas. Ways you can prevent this is by making sure to wash your hands and take showers on the daily basis. Everyone needs to be informed of this potentially life-threatening infection and use proper precautions to avoid contracting and spreading this infection. Here's my audience.